everyone, welcome back to my YouTube channel. My name is Jane and this is the Overseas Nursing Bands. How are you? This year we're going to go into a lot of more of our topics. Some things were introduced into the OSCE which I haven't dealt with at all. So I'm going to be dealing with some of those topics, and today we're going to be dealing with diabetes mellitus. But before we go on, how are you? Yeah, you all right? You okay? No, seriously, how are you? I hope you're taking care of yourself. There's nothing as good, as important as taking good care of yourself. All right, then. So, like I said, we're going to be doing evidence-based topics today, and we know that these are the things that were added into the OSCE end of last year. And we have the clinical professional-based values, 15 topics, and evidence-based, which is 15 topics, 14 topics rather. And it's a silent station and it's 10 minutes. You have to write clearly. You have to write legibly. I think before I continue, let me just explain again what evidence-based is. So if you have this at your back of your mind, it helps you when you're writing. I'm going to read evidence-based practices. These are approach to providing a care to patient that involves the use of clinical researches combined with clinical experience, patient characteristics, patient preferences. So what they are saying in a nutshell, that these are evidences gathered from a variety of relevant sources. So it's not something you make up your mind. You think, when when a child hiccups, you put a rope on the head. There's no clinical scientific research to that. I don't know why it works, but I'm just saying that for example. These are clinical evidence-based research from relevant sources, not just one source that you're having this. So like I said, again, we're doing with diabetes is a silent station, means you're writing, is a 10-minute station, and you write in bullet points. No need to just bullet point one XYZ point that you just go like that. That's how. So in evidence-based scenarios, you're going to be given a scenario. I'm not going to use any particular scenario here because, for one, you might get different scenarios. So I don't want you to get fixated on whatever I'm going to be doing today on the scenarios. Just know that, pardon me, whatever scenario you're giving, this answer applies. Okay? And as well, I want you to know this is a marking criteria. What you're expecting to tell the patient, what you expected to know to tell this patient in a diabetics only scenario. Don't go and use it in a wound or venous or any other, but in diabetes, whatever scenario, might say a young girl of or a woman of or a 45-year-old man, whichever they use, this is a tailored marking criteria answer for you to use. All right. So what you're going to be saying, and they're going to give you, when they give you a scenario, they'll give you a series of research summaries to read, okay? And that will guide your answers. But they tend to tailor, you can paraphrase, rephrase to the best how you remember on how to write or anything, but it's in accordance with this. So first off, let's not waste too much time. First off, you're going to summarize your main finding, from the article summary. You draw conclusions, making recommendation for practice. That's what you go. That's number one. So two, like I said, I've always said it on my videos. If you're writing, make sure you're writing legibly. Make sure you're writing clearly. Make sure you're not using abbreviations that are not known. I would actually avoid using abbreviations if necessary, honestly. That is what I would do. And as well, make sure you're using obviously your black ink. Amen. Amen. So now you're going to be informing this patient that he or she is less likely to suffer with hypoglycemia as she's not prescribed insulin. Note, you're letting them know whatever scenario you're giving, you're making them know that they're not going to suffer from hypoglycemia, as she is not prescribed insulin. You're also letting her know that, however, hypoglycemia remains a serious concern, and she should be vigilant to monitor her blood glucose levels and to recognize the signs and symptoms of hypoglycemia. Okay, you put that down, tick whichever scenario you come up with in diabetes. 2, you are advising this patient that hypoglycemia episodes are often caused by diet-related factors, such as missing a meal or not eating enough carbohydrate. So your emphasis is that you have to emphasize the importance of eating regular meals and discuss the daily recommended amount of carbohydrate for this patient. Bullet point. Point 2 taken. 3, you'll be advising this patient to observe for excessive sweating, things they will observe for, feeling faint, lightheadedness, blurred vision, new confusion, and or nausea, and to call emergency service 999 if she experiences, or her or him experiences, any of these symptoms. Okay? Another one, you need to advise the patient to inform friends and family that if she appears confused or loses consciousness, she may be having a hypoglycemic episode and will need emergency medical help by calling 999. You're also telling this patient, inform the patient that an episode of acute illness may cause irregularities in blood glucose. So she would need to monitor her blood sugars more frequently and report changes to her GP or her diabetic nurse, whatsoever. So these are, because I say, oh, how many things should I write? 5 bullet points is enough. Tick. You've got your OSCE passed with this topic of mine. So this is what your examiner will be assessing that you have passed across to this patient. You're going to get different, it's not one scenario. You can get anything. But if you've listed this 5, making sure your handwriting is legible, making sure you've written your name, number, and signed whatever, then you're passing your OSCE. Take it to the bank, like they say. And I'm going to be wishing you a very successful OSCE. Hope you do well, and I'll be waiting to hear your good news. Wishing you all the very best. All right? All right, take care. I hope this has helped you. Obviously, if you have any questions, don't send me an email. I get my email. Send me an email. I always reply. I think so. I think I do. All right. Thank you for watching. Thank you for staying. I hope it's helpful to you. Thank you. Bye.